Hello, my name is Dr. Coy Roskowski. I'm a chiropractic physician here at National Integrated Health Associates. And chiropractors are always known for the back and the neck, but I do treat a lot of various areas of the body, one of those including the feet. And one of the most prevalent conditions in the United States is plantar fasciitis. Most people don't know where plantar fascia is. It actually is in the bottom of your foot. It actually stretches from this ball area right here all the way down to your heel. And anywhere in that interim you can feel pain. Very typical pain is when you wake up in the morning and you take those first few steps out of bed and you feel sharp, almost like tearing type of pain. And you hobble to the bathroom, you take a few more steps, and maybe after like 20 steps, I start feeling better. That's a very typical plantar fascia. But for some people, it never goes away and becomes a real problem. So one way of checking on yourself is to actually look at the bottom of your foot and discover, are there calluses? So like on this particular person's foot, we have calluses that are in about the same position of the second toes. And that tells me is that she places more weight on the front portion of her foot. That means I know she's placing more pressure on the ball than the rest of her foot. The other thing that you can look for are calluses like bunions around the edges or dry, thick areas at the heels. Those are all indicators that you're putting a lot of pressure on the foot, making the skin thicker. Another thing that you can do is you can actually test the arch, which I'll show you how to do that on your own. But what I want to give another example of is how do you treat plantar fascia? And in our particular case, as a chiropractor, I can adjust her foot where we end up doing joint manipulations to any of the 24 bones of the foot. The other thing though is we can do a lot of soft tissue therapies, and those include things like active release technique, where we actually place our thumb in the foot and we start producing motion as we start to stretch and open up the tissues of the plantar fascia where they're being irritated. And there's many other techniques to do that are included when you're doing that. One of the other things you might end up doing is using orthotics, of which I also create orthotics for patients who have plantar fasciitis, that we need to raise their arches and restore the normal motion of their foot. And that helps to take away all the strain and pressure of the plantar fascia. So that may end up being an option for you. And the last thing to do, and this is a fun thing, you can do this with all your family. I'm going to have you stand up. On your hand, on your index finger, if you just go up to that line, that's about 1 inch. When a person is standing, you should be able to slide your finger in, and the edge of the foot should overlap that crease of your finger. So let's see how this person's foot is. So we just take our finger, here's the center of her arch, I slide the finger in, and for me, my finger's only getting about halfway. I can clearly see the edge of this finger. If I do it on this side, it's even worse on her left. And so if we don't get up to that edge, that's a good general indicator. My arches are dropped, and that can cause plantar fasciitis. So in this particular case, she's definitely could be a candidate for plantar fasciitis. Even if she doesn't have pain now, she may end up getting it in the future. So look for these things, and if you already have them, you may want to end up coming in for an evaluation and figuring out how you can fix these problems. Thank you.